Hello and welcome to this session. This session we are reviewing the differences between DKA and HHNS, diabetic ketoacidosis and hyperosmolar hyperglycemic non-ketotic syndrome. We're saying that these are both serious complications of diabetes mellitus. Both DKA and HHNS are medical emergencies that require medical attention and hospitalization. So early recognition and interventions are crucial for successful outcome. People with diabetes should monitor their blood sugar levels regularly and follow recommendations to seek prompt if they experience any symptoms of this complication. So DKA, HHNS. So in terms of causes, we're saying that DKA is primarily caused by severe deficiency of insulin. Remember, insulin is supposed to be able to drive the glucose in blood into cells, okay, and into fat cells, okay. So DKA is caused by severe deficiency of insulin, leading to uncontrolled hyperglycemia. And when you have uncontrolled hyperglycemia, guys, in blood, the cells are starving. And when the cells are starving, guys, they have to look for alternative sources of energy. And alternative sources of energy, they are fats. So fat cells are being broken down, and when they are broken down, they release wastes such as ketone, okay. And when you have excess ketones in the body, they change the physiology of the body, in that we have the ketone breath, okay, and the body the person has to breathe abnormally to get rid of those excess CO2 and the ketone bodies in that case. So you can see how deficiency of insulin brings about the complications in the body. So what triggers this DKA? We are saying one of the major cause is infections. We could also have missed insulin doses or new onset of diabetes. For HHNS is typically seen in type 2 diabetes, and it's due to underlying illness such as infection and other medical conditions that could increase stress. Okay, so what is the common denominator in both cases? Infection, guys. Infection will cause this DKA, okay? That is the major trigger. So what population is mostly at risk of DKA? Yeah, DKA. Which population? Newly diagnosed diabetes, okay? Newly diagnosed diabetes. Which age group is more commonly affected by HHNS? Yes? The older adults. Very good, guys. So we can be able to see the population affected in terms of pathophysiology, or although we have already explained it, but we can also repeat for emphasis. DKA occurs primarily in individuals with type 1 diabetes, but it can also occur in type 2 diabetes. It results from severe deficiency of insulin, leading to buildup of ketones in the blood. So the absence of insulin causes the body to break down fats for energy, resulting in production of ketones, which lead to a state of acidosis. DKA, guys, when you look at the pH, it's going to be more of acidic because of the ketones. Okay? Hyperosmolar hyperglycemic state mainly affects individuals with type 2 diabetes, particularly the older adults. It is characterized by extremely high glucose levels, leading to severe dehydration and hyperosmolarity. And hyperosmolarity means that there is increased concentration of solids in blood, okay. And when that happens, guys, it's going to withdraw water in the blood vessels, more and more water in the blood vessels. As a result, you're going to have severe dehydration for the cells. Yeah, okay? So unlike DKA, there is minimal or no ketone production in HHNS. Guys, this is significant difference. So we have a question here. Which of the following is the primary difference in pathophysiology of DKA and hyperosmolar hyperglycemic state? Yeah. We're saying that DKA results from severe dehydration while HHNS is characterized by acidosis. Guys, is that correct? DKA, HHNS characterized by acidosis. Ketones are more likely to be in DKA, okay? And in both cases, we'll be having dehydration. In fact, in HHNS, the dehydration is severe because of those hyperglycemic levels, okay? DKA, DKA is caused by insulin deficiency, correct, and ketone production, while HNS is associated with the extreme hyperglycemia and minimal ketone production. Guys, this is correct, okay? This is correct and it can be kept for consideration. DKA primarily affects individuals with type 2? No. Individuals with type 1 and some in type 2, okay? HHNS affects individuals with type HHNS affects individuals with mainly type 2, especially the elderly, okay? So this is not correct. Lastly, DKA develops more gradually over several days, while HHNS develops rapidly. Guys, it's the other way round, okay? It's the other way round, okay? Yeah. So DKA develops more rapidly while HHNS develops gradually. Okay? Thank you. In terms of onset, guys, onset, we're saying DKA tends to develop relatively rapidly, often within hours to a day, while HHNS has a more gradual onset and typically taking several days to weeks to develop. Okay? The complication found mainly in type 2 diabetes is which one? HHNS, guys. HHNS, especially the elderly. A patient is found with a blood glucose of 375 milligrams per deciliter, positive ketones in urine, and blood pH of 7.25. Which condition is this, guys? Ketones. DKA. Very good, guys. You're doing great. Aha. Very proud of you. Look at this one now. Which one of the following is not a sign or a symptom of DKA? DKA, ketones in the body. Okay. Positive ketones in the body. That is the defining of this one, feature of this one. What about abdominal pain? Yes, abdominal pain is there. Polydipsia, yes. Oliguria is the sign that should not be here. You are providing care to a patient experiencing diabetic ketoacidosis. The patient is on insulin drip and their current glucose is 300. In addition to the insulin drip, the patient is also on 5% dextrose, 0.545 normal saline infusing in the right antecubital vein. Which one of the following signs causes concern? Patient's skin and mucus are dry. Yeah, because they are dehydrated. Yeah, they are suffering from these hyperglycemic levels. So the cells have lost water to the glucose in the blood vessel. So they are dehydrated. Yeah, that's okay. That's a sign and symptom. Patient is nauseous. Yeah, they're vomiting. The chemoreceptor trigger zone has been activated. So they feel nauseated. That's okay. That's a sign and symptom. Complaints of thirst. Yeah, guys, what did we say are the major clinical manifestation of the 3 P's of diabetes? polyuria, polyphagia, polydipsia. Yeah? This is what is going to cause concern, guys. Potassium level of 2.3, the recommended potassium level or the normal range should be 3.5 to 5.0, guys. This one should cause concern. Yeah, we should put this patient on a cardiac monitor, okay? Yes, correct, guys. Wonderful. In terms of glucose level, we are saying that in both cases, glucose will be elevated. But what is the difference? In DKA, blood glucose levels are usually very high, typically above 250 milligrams per deciliter. That is 13.9 milliosmoles per liter. Remember to convert this one in millimoles per liter, you simply divide it by 18 and you'll be able to get the difference. Okay? What about HHNS? Blood glucose are extremely high with exceeding 600 milligrams per deciliter. That is 33.3 milliosmoles per liter. So what is the difference in blood glucose level between DKA and HHNS? DKA has significantly lower glucose level compared to HHNS. Look at this one. This one above 600. This one 250. You get the difference, guys? Great. I'm happy you guys are getting it, and that means a lot to me, guys. Yeah. So HHNS has the following signs and symptoms, except they have dry mucous membrane. Yeah, they are dehydrated. Polyuria. Yeah, the 3 P's of DM. Blood glucose greater than 600. Yeah, that's what we just said. Small breathing. Aha. This is where ketones are formed, excess ketones, and the body compensates so that it's able to remove all these, okay? And this is more prominent in DKA. So D is the correct answer. These conditions happens gradually and mostly affects older adults. How many times, guys, have you said that HHNS develops gradually and mainly affects older adults? Guys, keep that in mind. A patient has infection and reports not checking their blood glucose level or regularly taking metformin. What condition is this patient most at risk for? Metformin. Guys, metformin is used to treat which type of diabetes? Mainly type 2 diabetes, correct. So which condition is more associated with type 2 diabetes? HHNS. Very good, guys. Very good. Let's move to the next point, and we are looking at in terms of ketones. What about ketone bodies? What are ketone bodies? Byproducts of fat metabolism, okay? And they have to be removed from the body. Okay, so that's why we breathe abnormally for us to remove them, okay? So in DKA, ketones are produced as a result of breakdown of fat for energy. This leads to a characteristics of ketone breath and acidic pH, ketoacidosis, acidic pH. HHNS, ketone bodies are not typically present in blood in significant amounts, and blood pH may be normal or slightly acidic. So what about this one, guys? Ketone production is absent in hyperosmolar. Yes, it's absent. True. It's absent. Correct, guys. What about the dehydration? In terms of dehydration, we're saying in both cases we are going to have dehydration. But because HHNS we have more glucose, we're going to have more severe dehydration, okay, due to prolonged hyperglycemia and osmotic diuresis, okay? So osmotic diuresis is present in HHNS and DKA due to the kidney's inability to absorb the excessive glucose, which causes glucose to leak into urine, which in turn causes extra water and electrolytes to be excreted. Guys, that was true, and I'm happy that most of you picked that one. Congratulations, guys. Let's move on to the mental status. And in terms of mental status, we are saying that it will again be more severe in HHNS. Okay? This is because of profound lethargy, confusion, and even coma. In terms of Kussmaul breathing, this one is related to ketone bodies, okay? So diabetic patients with DKA may exhibit Kussmaul breathing, which is usually deep, labored breathing as the body tries to blow off excess acidic ketones, okay? Kussmaul breathing may not typically be seen in HHNS because there are no ketones being produced there, guys. In terms of electrolyte imbalance, we're saying that DKA is associated with significant electrolyte imbalance, including low potassium. Okay, so the patient is likely to suffer from hypokalemia in DKA. HHNS may have less pronounced electrolyte imbalance compared to DKA. So a patient is being discharged home after recovering from HHNS, which statement by the patient requires patient re-education about this condition. The patient says, I will monitor my blood glucose level regularly. That's correct, guys. Motivate the patient to do this more often. This condition happens suddenly without any warning changes. Suddenly? What about DKA? This should be for DKA, okay? Let's keep it for consideration. If I become sick, I will monitor my blood glucose more frequently and drink lot of fluids. Correct, guys. When the patient is stressed, when the patient is sick, we'll need more doses of insulin because there is more glucose. So this patient is right. Needs a pat on their shoulders, guys. This patient is right. Lastly, it's important I take medication as prescribed. Yeah, that's what we normally say. Take the patient medication as prescribed. In case of any adjustment, let the guy who prescribed know. So the correct answer for this one was B, and that was good for us. In terms of prevalence, DKA is more common in type 1 but can also occur in type 2. We had already said that. And HHNS is more common seen in individuals with type 2, especially the older patients. Okay? So which type of diabetes is commonly associated with DKA? Come on, guys. Should be type 1. Okay? Yeah, don't confuse. Great. What about the What about this one? Which one of the following is not a medical treatment for DKA and HHNS? IV regular insulin? Yeah, we need to push the glucose in blood to cells. Remember, so that the cells can have the glucose, the fuel. Isotonic solution? Yes, these patients are dehydrated, guys. They need solution. IV solution, IV potassium, yes, especially in DKA, where they're experiencing hypokalemia, they need potassium replacement, okay? Guys, bicarbonate should not be in this case. So, generally for these patients, they need fluids to replace those that they have lost through urinating. Remember, the fluids can also thin out blood sugar. They also need electrolyte replacement. Electrolytes are the minerals in blood such as sodium, potassium, chloride as they carry the electric charge. Then insulin therapy, insulin reverses diabetic ketoacidosis, guys. That was excellent. Lastly, guys, I'm here now and I'm talking in terms of treatment, which we're already doing. And they're saying DKA, treatment of DKA involves administering insulin, the fluids, and the electrolytes to correct the acidosis. Remember, acidosis, insulin, and normalize blood sugar, the fluids, and the insulin, and rehydrate the patient. Okay, the patient is dehydrated. HHNS treatment primarily focuses on aggressive fluid replacement to address dehydration and gradually lowering blood glucose level with insulin therapy. Okay, so what is the primary treatment focus for DKA? Yes, correcting acidosis with insulin and fluids. Excellent, guys. Guys, remember that you can access my channel. You can access my channel and get more questions about DKA and HHNS. Okay? Thank you so much and continue practicing. We have to make DKA and HHNS be understandable for all of us. Kindly subscribe in order to remain updated of any more videos. Thank you so much and have a nice time.